Hi, and welcome to DIYInjuryRehab.com. What is tennis elbow? By myself, Ian Constable. And, more importantly, how to fix it for only $3.99. So make sure you stay to the end and find out how to fix it for only $3.99. Or, alternatively, at any time you can click the link below. So, what's in the video? We're going to deal with some important points. Firstly, what is tennis elbow? And probably more importantly, what tennis elbow is not. Where does the pain come from? And how to stop that pain. Steroid injections don't work. We're going to discuss the causes of tennis elbow and why does a certain type of exercise work. And we're going to give you one simple, effective exercise. So, what is tennis elbow? Well, the tendons are complex structures that attach muscle to bone. They can be long and thick. Think of your Achilles tendon. It's very long, it's the longest tendon in the body, and it's quite thick and chunky, certainly in some people. They can be long and thin. If you look at the back of your hand and your toes and straighten your fingers out, you'll see the thin tendons that go to work your fingers. And they can be short, which is your forearm muscles that are attached at the elbow. So you can have short, stubby tendons. The tendon that attaches to the outside of the elbow is known as your common extensor tendon and attaches to the bony bump on the outside of your elbow. And this bony bump is called the lateral epicondyle. In medicine, lateral means towards the outside. So this is a diagram of the muscles in the back of your left forearm, and the arrowed part, the black dot there in the middle, represents your lateral epicondyle. And you can see that there's quite a few muscles attached to this. Certainly numbers 1, 2, 3 and 4 all have some degree of attachment, and there's a couple of deeper muscles as well that also attach around the lateral epicondyle. In tennis elbow, the main problem is the extensor carpi radialis brevis, and that is number 3 in this picture, the blue muscle, and that slides up underneath number 2, which is the extensor digitorum, and the extensor carpi ulnaris, which works the outside of the hand. Tennis elbow is a degeneration in the tendon of the extensor carpi radialis brevis, and sometimes the extensor digitorum is involved as well. This is a slide of a normal tendon, and you can see that it's nice straight wavy lines, and all the cells are arranged in a regular fashion. And what we're looking for on this is any black dots, which, because of the way that the cell is stained, the muscle is stained, these cells show up as black dots. As you can see, there's very few black dots in this picture. The next slide is a slide of a degenerated tendon, one that's got problems. And you can see all the fibres are arranged in a haphazard fashion. They're all over the place, higgledy-piggledy, and there's lots of black dots. This is showing actively dividing cells. So there's an attempt to repair here. The term tendinosis refers to the degenerative changes that occur when a tendon has failed to heal properly after an injury or after repetitive microtrauma resulting from overuse. So basically what that means is your tendons are constantly breaking down and rebuilding, but because you've got a problem, then it breaks down quicker than it builds back up again. And this is not an inflammatory reaction. Okay, so there's no inflammation as such, because we know that because there's certain telltale chemical markers you get for inflammation, and you can either find them in the tissue itself or in the blood. And with tennis elbow and most tendinopathies, which is tendon problems, there are no chemical markers. And also when we look at the slides, there are no inflammatory cells. So when we look at these slides in damaged tissues, there is no telltale inflammatory cells, no telltale inflammatory markers. So let me repeat it again. Tennis elbow, most of the time is not an inflammatory reaction. So therefore, you would think it would be sensible not to take anti-inflammatory medication. They do have a pain-killing effect, however, but there's other drugs such as paracetamol that are safer to take. Basically discuss it with your pharmacist. The reason I'm saying there's a risk taking anti-inflammatories. They do affect your stomach and a few other problems as well. And also, because it's not an inflammatory reaction, there is no lasting benefit from cortisone shots. So if it's not inflammatory, where does the pain of tennis elbow come from, especially if you've had it for more than a few weeks? Right at the beginning, first time you've ever had it, there may be an inflammatory reaction, okay? But that's very short lasting and probably doesn't happen that often. But this is the proper tendinitis, and it was thought that all inflamed tendons, all tendons were inflamed. We now know, as I've explained previously, that is now not the case. So it's more likely that tendinosis rather than tendinitis. So tendinitis, itis in the end of something, means inflammatory, inflamed, appendicitis, gastritis, hepatitis. Anything with itis in the end tends to mean inflammation. Tendinosis is a term that describes cell proliferation and a new blood vessel response. Alright, so if you talk about cell proliferation, if you remember back to the previous slide, there was lots of black spots. So there's cell proliferation taking place. And it's thought that this sudden new growth of blood vessels, the fancy word is angiogenesis, and the rich supply of nerves that grow with the blood vessels are responsible for the pain. Okay, so in response to the degeneration, there's new tissue tried to be laid down, and in an attempt to do that, there's new blood vessels grow in the area, and these blood vessels have a rich nerve supply, and it's this nerve supply that's giving us the pain they reckon nowadays. So if it is this new growth of blood vessels that's responsible for the pain, how do you stop the pain? Well, you can inject a substance which scleroses, and that basically just means shrinks or destroys the blood vessels. It's the sort of thing you would get for varicose veins. You inject the blood vessels and they shrink up, shrivel up using chemicals. So, and when you do that to this area, the vessels shrink up and the pain in the tendon disappears. So your tennis elbow gets better. In fact, there is now a new treatment for Achilles tendon pain, where what they do is, under very strict conditions and very exactly, they localise it using ultrasound guidance and things, but you don't need to worry too much about that. But what they basically do is they take a needle and they squeeze high pressure water. It's just saline normal salt solution. This sprayed under high pressure underneath, between the tendon and these blood vessels, and that basically just strips these blood vessels off, and the pain goes away, and the athlete can go back to playing professional football or whatever it is almost immediately. So they're almost certain that it's these blood vessels that cause the pain. So it's about controlling these blood vessels. That gets rid of your pain, and that makes your tennis elbow feel better. So while we're talking about injections, let's talk about steroid or cortisone shots. They don't work. It's as simple as that. There's more and more evidence coming out now that this is the case. They're quite often and regularly given by doctors to calm the inflammatory response of the body. In this situation, as we've explained several times now, there is little or no inflammatory reaction in tennis elbow. So therefore, giving anti-inflammatory medication or giving anti-inflammatory injections is not useful. But patients quite often do get better. You're bound to have known somebody that's had a tennis elbow shot and they've got better. Right? So patients generally do get a good response initially. It doesn't last in a large percentage of cases. If you're giving the injection properly and good technique is used, and the technique is basically to inject the steroid around the tendon, not into the tendon, and it's probably that pushing in the fluid or the steroid has the same effect as injecting under high pressure that we're talking about for the Achilles tendon. So it probably has an effect on the new blood vessels, but chances are they will grow back because they're not totally stripped away, they've only been just settled down a little bit. If the injections are given badly, or they're given too often or too frequently, then the injections can actually damage the structure of the tendon itself, and that can cause complete rupture. In part 2 of the video, we're going to discuss the causes of tennis elbow pain, what causes it, what brings it on, and how it actually develops in the first place. So if you've got the time, stop now and go to part 2, please. Okay, it's very simple. One simple, effective exercise. Once you learn how to do it, you don't need any equipment. So you don't need anything at all. It can be done anywhere. You can do it in the house, sitting in your home. You can do it at the office. You can do it sitting in your car, sitting at traffic lights or whatever. Okay? And it's been filmed. We filmed it for both your left elbow and your right elbow. So if you do buy this, you get the choice for your left elbow or for your right elbow. And you're sent a couple of videos. The first one's maybe 5-6 minutes long, and it shows you exactly how to do the exercise. It takes you through exactly what you should be doing. It looks very simple, it is very simple, but it needs to be done in the right order, in the right sequence, with the right amount of pressure. Okay, I'm going to give you several views. So you look at it from the side, you look at it from the front, you literally look at it over my shoulder. So you see me showing you how to do the exercise, and I carefully explain what you need to do, and more importantly, what you need not to do. You know, you don't need to do this to get the best results. And all you have to do is watch that video a couple of times, work out exactly how to do it, and it's as simple as that. You will be totally pain-free. Right? We operate a guarantee. So there's a 30 money back policy. So if you're not happy at all, you can get your $3.99 back. Simple as that. So if it doesn't work for you, we do it through PayPal and you get your money refunded immediately. So there's no risk to you whatsoever. And as I say, it's only $3.99. So when I say there's no risk, the exercises are supposed to hurt a little bit. So they have to be done into some pain. So you need to be prepared to put up with a little bit of discomfort. Okay, so this is one of those real life situations where it is no pain, no gain. Okay, everybody talks about that. This is actually one of those. So it has to be uncomfortable and slightly painful. If it's not, you're not doing it properly. But we'll explain all of that in the video. It's very straightforward. Okay, so this is one simple exercise, $3.99. Okay, that's about the price of a cappuccino, certainly here in Glasgow, for a pain-free elbow. Okay, all you need to do is click on the link below. Thanks for listening, and click that link.